Hi, my name is Mick Matthews, Senior Programme Officer for the Network of Sex Work Projects, NSWP, the Global Sex Worker Network. And welcome to the second of the NSWP Global Fund Basics video series. This one is on country coordinating mechanisms, most commonly referred to as CCMs. And it is some of the CCM policies we're going to look at now. So slide 4. The Global Fund has many documents, policies and guidance notes on the CCM, including CCM Policy, Operational Policy Manual, CCM Funding Policy, the Code of Ethical Conduct for CCM members, CCM Guidance Note on Engagement, and the Global Fund Community Engagement Toolbox, which is a resource developed by the regional platforms. These and the rest of the many documents can be found by Googling country coordinating mechanisms or searching for the specific documents. And of course, they're all available on the Global Fund website. There is not time in this video to look at all the policies, so I just want to touch on a couple that I think are particularly helpful and important. The Code of Ethical Conduct is a particularly useful document, and you may be surprised how many requirements there are within it. I'll give you one example. CCM employees, and this refers to CCM Secretariat employees, are required to provide timely, professional and transparent support to all members of the CCM, including responsible management of information, budgets and CCM minutes. Responsible management of information means that CCM members should get meeting papers or the opportunity to respond to funding requests, etc., in good time. So if you don't, and you get them at the last minute, with little time to read and comment, you can use the Code of Ethical Conduct to complain. If you are not on the CCM, then your community representatives are required to share received information with constituents, which is you, early enough and with enough detail to enable constructive feedback in time to influence a decision. They're required to collect and reflect constituents' views and concerns at CCM meetings while retaining the duty of care to the broader public health interest. They're also required to update constituents on CCM decisions, in particular when constituents, which is you, have provided input. If this is not happening, again, the Code of Ethical Conduct can be used to address this because CCMs are required to ensure that everyone complies with the code. The CCM policy is also useful and clearly states that CCMs are required to include key population representatives. Page 4, paragraph 15, under Principles for Coordinating Mechanisms, and again under Requirement 4 of the 6 eligibility requirements, point 2, where it says people from and representing key populations. But before you throw your hat in the air in celebration, there are a few things to be aware of. The principles reference the Key Population Action Plan 2014 to 2017 to define key populations. Now, although sex workers are referenced throughout the text of that document, the criteria used to define key populations is not so specific. And there are 3 areas I just want to mention. 1. Epidemiologically, the group faces increased risk vulnerability and/or burden with respect to at least one of the three diseases, due to a combination of biological, socio-economic, and structural factors. And then 2, access to relevant services is significantly lower for the group than for the rest of the population, meaning that dedicated efforts and strategic investments are required to expand coverage, equity, and accessibility for such a group. And then finally, number 3, the group faces frequent human rights violations, systematic disenfranchisement, social and economic marginalization and/or criminalization, which increases vulnerability and risk and reduces access to essential services. A community needs to meet all 3 of those criteria to be defined as a key population. The Global Fund recognizes men who have sex with men, transgender men and women, sex workers, injecting drug users, people living with HIV, and people in prison and detention as the main key populations. But countries may also include other communities in their definition of key populations, such as migrants or truck drivers. And finally, to successfully advocate for a specific seat for a sex worker, this would need to be supported by the epidemiological evidence that sex workers are at increased risk from HIV or TB or malaria. Nevertheless, the CCM policy is a useful reference document when you are discussing CCMs. As I said, it's not possible to go into detail on each of the policies, but it is worth making yourself familiar with some of them because they can be really useful in your advocacy.